Welcome to the IQon Elite Spectral CT module. This module will give you an overview of the key features and benefits of IQon Elite Spectral CT. It will also help you understand how IQon Elite Spectral CT gets differentiated from traditional dual energy systems. Click Launch to begin. By the end of this module, you should be able to describe the key features and advancements of IQon Elite Spectral CT, reflect on the benefits of IQon Elite Spectral CT through various case studies, make comparisons of IQon Elite Spectral CT with GE, Siemens, and Canon. Since imaging is at the heart of healthcare, it must evolve along with healthcare. We know that imaging is under great pressure to improve access, quality, and cost of care. This is especially demanding given the challenges health providers face. Almost half of the radiologists report feeling burned out, overwhelming increase in data, and increasing costs from unnecessary, suboptimal, and repeat imaging that reached more than $12 billion annually. For a confident diagnosis and treatment, health systems need to address the needs of many stakeholders. These include patients and caregivers, technologists, radiologists, referring physicians, and administrators. Each stakeholder has unique challenges and needs a company focused on always finding a way to make life better. Click on each tab to know more. Let's now talk about how the new pillars of IQon Elite directly tie to the first-time right pillars. The multiple layers of spectral data improve tissue characterization and visualization, enabling diagnostic certainty which leads to better outcomes. With IQon, radiographers can perform routine protocols without encountering the patient selection dilemma. The spectral results are always there. With IQon Elite, every scan is spectral without compromise, therefore enhancing both staff and patient experience. The ability to acquire and analyze spectral results within the current workflow practice enables our customers to benefit from the powerful advancements designed to fit their workflow. By doing so, IQon Elite's end-to-end solution simplifies data and insight gathering. These three differentiated benefits of IQon Elite enable our customers to deliver improved patient care through earlier confident diagnosis, eliminating the need for repeat and follow-up scans, which directly translate to reduced costs. IQon Elite Spectral CT is the world's first and only detector-based spectral CT. In a single scan, it gives 100% diagnostic layers of spectral data. In addition to the true conventional images, IQon Elite Spectral CT also provides monochromatic images, material decomposition images, and images that improve lesion characterization, helping our customers improve diagnostic accuracy and patient outcomes. Low mono-E's can boost the iodine signal to enhance any subtle lesions and improve the contrast-to-noise ratio, whereas high mono-E's can reduce artifacts from beam hardening and metal. The virtual non-contrast result can be used for non-contrast imaging without scanning. It can help with radiation dose management on the patient. Iodine no water and iodine density results are material density images that allow visualization and quantification of iodine in an image. Effective Z images allows structure characterization based on different material content. For example, they can be used to differentiate between types of kidney stones. Calcium suppression and electron density have been recently added as a part of the spectral results. These results are available on the IQon Elite configuration. Calcium suppression images are virtually calcium-free images. They can play a role in assessment of disc herniation and visualization of bone marrow edema, conditions that could not be diagnosed on conventional CT in the past. Electron density maps are important for proton therapy to help determine the exact location for the energy deposits. In current practice, they are created through lookup tables and conversions. With IQon Elite Spectral CT, these can be created directly from the spectral data without need for any processing. The layers of spectral data delivered by IQon Elite enable improved outcomes. Diagnostic certainty. Every scan is spectral without compromise. Powerful advancements that fit your workflow. And certainty in integrated solution. Click on each tab to know more. Radiologists are often faced with situations in which the image doesn't give them a clear idea what they are looking at. A very common example is a renal lesion as found in this image. It is easy to find, but the referring physician wants to know what it is. This is important to determine the course of treatment. If I would only have done a non-contrast scan first, I could have compared and determined whether the lesion is taking up iodine. I've picked the wrong protocol. IQon Elite Spectral CT uniquely provides layers of spectral data that allows the first exam to be the right exam. Spectral results provide a lifeline for radiologists that they can use to solve these conflicts. Virtual non-contrast images can be utilized to see if there is an HU difference between the VNC and the contrast-enhanced scan. If so, the lesion is taking up iodine and very likely a malignant lesion and needs treatment. If not, the lesion is likely to be benign and the patient can go home. In this particular case, the radiologist looked at another spectral result showing iodine density. The measured density was found to be 0.1 mg per ml, which is a clear indication for a benign lesion. A key feature of IQon Elite Spectral CT is its ability to provide spectral results 100% of the time. This eliminates the need to decide what patient and what protocol to utilize. Every patient will get a spectral scan. It allows the clinician to acquire conventional and spectral data simultaneously in a single scan. Clinicians can also scan the most complex and routine cases, diverse patient population, without compromise in dose, field of view, or workflow. Spectral results eliminates the need for patient selection, without compromise in dose. A recent publication shows that the retrospective availability of spectral image information provides diagnostic certainty for the evaluation of examinations in which there was prospectively no indication of the need for spectral image information. The Sosna paper is another example of the importance of the retrospective availability in the 80% of the cases that turned out to have a retrospective need for additional results. IQon Elite is the only solution that can provide the meaningful spectral results from scans that were not acquired in dual energy mode. A very powerful advancement of the IQon Elite Spectral CT is its ability to enable customers analyze spectral results as part of the routine scan anytime, anywhere, and within their current workflow practice with the utilization of results on PACS, unique IntelliSpace portal apps, and Magic Glass. This enhances our customers' ability to deliver positive outcomes to their patients. IQon Elite Spectral CT creates true 120 kVp conventional images and spectral images from a single acquisition. It acquires spectral results using conventional single kVp protocols and makes no compromises in image quality, spatial resolution, noise, low contrast, between images created from conventional and spectral acquisition modes. There are no compromise in FOV 0.50 cm FOV for all CT images. Neither are any limitations in using 3D dose modulation simultaneous with spectral scanning. It makes full use of model-based iterative reconstruction on spectral results and has an ability to create spectral images from a cardiac acquisition performed with rotation speed of 0.27 seconds or faster. The Spectral Magic Glass is unique to Philips and the IQon Elite Spectral CT. It enables on-demand, real-time, and simultaneous analysis of multiple spectral results. It also directly integrates into a health system's current PACS setup and enable our customers to benefit from spectral results anytime and anywhere from the enterprise. This is an example of the iSight PACS. As the user scrolls through the images and identify an incidental finding, for example in this kidney on the left, all they need to do is launch Spectral Magic Glass on PACS. The PACS then locates the spectral datasets and launches the Spectral Magic Glass on PACS Viewer, enabling them to compare between the conventional images and the spectral images. On the right side, we're looking at the monoenergetic images, and through the kV slider, we're able to change the energy level to go from 40 kV or kV to 200 kV, enabling us to improve the contrast conspicuity. We could also look at iodine density images. The iodine density images help us quantify the amount of iodine in a specific region of interest. Another example is to look at the effective atomic number images, or effective Z. This could help us characterize the lesion in the kidney. Once the physician has gotten the answers that they need, they can simply close the viewer and resume their reading on PACS. The Spectral Magic Glass is unique to Philips and the IQon Elite Spectral CT. It enables on-demand, real-time, and simultaneous analysis of multiple spectral results. It also directly integrates into a health system's current PACS setup and enable our customers to benefit from spectral results anytime and anywhere from the enterprise. IntelliSpace Portal creates a seamless workflow to allow the use of our advanced visualization tools to improve outcomes. With the ability to read and assess images from anywhere in the enterprise, the workflow for our customers is simplified. Our customers can achieve diagnostic certainty through the integrated solutions we provide. Performance Bridge is a comprehensive set of intelligent tools, data analytics, and dedicated expertise designed to enable continuous organizational performance improvements. SmartPath is a robust portfolio of updates and upgrades which can deliver expanded clinical capabilities and important workflow efficiency gains. Technology Maximizer is a new subscription program that delivers ongoing software updates and comprehensive hardware refresh to keep new CT technology performing at state-of-the-art levels for a full 5 years after installation. Available alongside a Right Fit service agreement, Technology Maximizer assists customers in maximizing the leverage of their imaging investments. 24/7 proactive monitoring helps you solve problems before they can impact your day-to-day operations. Here is what Dr. Chip Truitt says about IQon. This section highlights the positive impact of IQon Elite Spectral CT over conventional CT. There are 3 categories depicting distinctive features of IQon Elite Spectral CT. Click on a tab to begin. Mary sees emergency because of the extreme abdominal pain she gets. The doctor advises her to get an abdominal pelvis scan done. She was scanned on the IQon Spectral CT. Upon reviewing conventional results, clinician noted that the pancreatic duct appeared to be dilated, but they couldn't identify the cause using conventional images alone. Scan was immediately reviewed using spectral results available every time a patient is scanned on the IQon. Upon review of the additional data, clinician identified a tumor in the head of the pancreas, and patient was referred for an endoscopic ultrasound biopsy, which showed a tubular adenoma of the ampulla of Vater. This case demonstrates the ability of the IQon Spectral CT to enable a short time for diagnosis with transparent and spectral results. With IQon Elite Spectral CT, there was a decrease in time for the patient to start treatment of a pancreatic tumor. Meet Anthony, a cancer survivor. Anthony went to the hospital complaining of abdominal pain. The doctor scheduled a routine abdomen CT on the IQon Spectral CT. After reviewing the reports, the doctor identifies a left kidney lesion as well as paraspinal muscle metastatic lesion using 40 keV mono-E spectral results. The kidney lesion is demonstrated much better with the low mono-E, but look around. Do you see anything else that is enhancing? Did you see the paraspinal lesion on the conventional CT image? The physicians didn't see it either. He only noticed it on the mono-E image. Let's analyze another spectral case study for the IQon Elite Spectral CT. Meet Charles, who went to the doctor complaining of shortness of breath. The injection failed due to Valsalva, causing a non-diagnostic conventional image on the left. It has suboptimal contrast, making it non-diagnostic for PE assessment. But because Charles was scanned on the IQon Spectral CT, spectral mono-E images were retrospectively used to improve the contrast enhancement and salvage the otherwise non-diagnostic scan. Sarah comes to the hospital for a follow-up session. She has been treated for chondrosarcoma, and after chemo or radiation treatment, she was advised a chest, abdomen, and pelvis scan. The scan was done as a routine follow-up. The reports showed a suspicious staining in the left axillary region. Reviewing of the low mono-E showed an enhancing lesion. Because the patient had been scanned on the IQon for both scans, the radiologist went back and reviewed the first scan that was done. The lesion was much smaller, but still present at the time of the first scan. Although clearly visible using spectral results, the lesion was missed initially and not reported in the first scan. This is one of the reasons that the spectral CT is such a valuable addition to radiology departments and can make the difference between seeing something or missing something. Every scan is a spectral scan when you can see the spectral results on every patient scanned on the IQon Spectral CT. With the IQon Spectral CT, a wide range of patient types can be scanned, from pediatrics to bariatric. With spectral results always available, there is no limit to the patients that can be scanned on the IQon Spectral CT. A 6-month-old scanned through the ED following a motor vehicle accident. With the IQon Spectral CT, the technologist does not have to spend valuable time picking the correct scan protocol. The ability to use low-dose protocol tools and always get spectral results is the best combination when it comes to pediatric patient care. With the IQon Spectral CT, your customers are not limited to scanning any patient due to size or weight. You can scan even those larger patients that traditionally a scanner might have difficulty with. This bariatric patient had a BMI of 68 and weighed over 300 pounds. These patients require the same care as any other patient. This case study demonstrates how spectral magic glass was used to aid in the diagnosis of an emergency department or ED patient. With spectral magic glass at the clinician's fingertips, giving them the ability to simultaneously review several spectral results, the perfusion defect in the pons became more visible. The clinicians were able to make a confident diagnosis for this ED case without any implication on their workflow. This is a cardiovascular TAVI scan, which was done with low amounts of contrast. Low mono-E images were used on the Advanced Vessel Analysis application on the IntelliSpace portal to boost contrast and run the segmentation. This is especially important for patients with renal insufficiency that cannot tolerate typical levels of iodine contrast, which is quite common in the TAVI patient population. First, let's look at the Kartai Cancer Center case study. Because of the powerful capabilities of IQon, patients can now be scanned with low volume of contrast, and clinicians can retrospectively boost the contrast enhancement using low mono-E images. There is a 34% reduction in time to diagnosis and a reduction of 25% for follow-up scans. Based on the reimbursement rates in the U.S., this would result in a $453 saving per follow-up scan. The amount of savings that institutions can achieve would depend on the throughput of the hospital and the relevant patient population. If you apply this study to a large network of hospitals, or IDN, you would eliminate roughly 20,000 scans and have an annual savings of nearly $1 million. Take a moment to analyze the data from the University of Cologne case study. This study is from the University of Cologne in Germany. We're waiting for it to be published, but just to give you a sneak peek at economic benefits of IQon in incidental liver lesions. The site chose to focus on this clinical condition because focal liver lesions represent a common incidental finding in 33% of imaging studies, and such incidental findings always require further workup and follow-up. Because of the powerful capabilities of IQon Spectral Detector CT, clinicians can now get additional information on these liver lesions from the first CT scan. These layers of spectral data improved the diagnostic confidence and resulted in 44% reduction in follow-up scans, which amount to potential savings of €100,000 annually for the institution. This savings is from a single clinical indication. Imagine the potential saving that can be achieved by applying IQon spectral results to other clinical conditions. This study was accepted to a journal, but it has not been published yet. We're sharing this exciting outcome with you today because it will eventually be part of the customer presentation as soon as the study is published. Other benefits of IQon Elite Spectral CT are all surveyed organizations have seen an average decrease of 20% in repeat CT scans. Hennepin Healthcare saw a 40% decrease in follow-up exams, and all surveyed organizations agreed that IQon Spectral CT increased their confidence in diagnosis. IQon Spectral CT with the spectral detector technology is the only solution capable of delivering certainty of spectral results without the trade-offs usually associated with dual energy techniques. The proprietary nano-panel prism detector powers the IQon Elite Spectral CT to eliminate the compromises associated with dual energy techniques, delivering spectral insights for every patient in every scan. The next slide shows the different acquisition techniques to DE. Philips IQon Elite Spectral CT is far ahead of its competition with other brands. Our competitors, like GE Revolution and Siemens Force, use source-based technologies and make trade-offs when producing spectral results. They cannot have both spectral and true conventional images at the same time. With IQon, both spectral and true conventional images are provided. Siemens has a field of view limitation, whereas GE has a dose modulation limitation, potentially missing the key information. Let us analyze how spectral detector technology has advantages over source-based techniques. Click on the video to learn more on how Philips-based spectral detector solutions has many advantages over source-based techniques. You have come to the end of the module. Here are the key takeaways from this course. Diagnostic certainty is the first pillar for IQon Elite because it addresses our customer's greatest challenge, getting a confident diagnosis in the first time. A key differentiator of IQon Elite Spectral CT is its ability to provide 100% spectral results. The Spectral Magic Glass enables on-demand simultaneous analysis of multiple spectral results that integrates into a health system's current PACS setup. Customers can analyze spectral results as a part of the routine scan anytime, anywhere, and within their current workflow practice with the utilization of results on PACS, unique IntelliSpace portal apps, and Magic Glass. The Philips Solutions portfolio, which includes Performance Bridge, SmartPath, Tech Maximizer, and 24/7 proactive monitoring, are designed to make your radiology operation more efficient and effective end-to-end. Spectral detector technology is steps ahead of the competition as our competitors use source-based technologies and therefore have to make trade-offs when producing spectral results. It's time for a small assessment to evaluate your understanding and retention of the concepts covered in this module. You will be presented with 5 questions. You need to answer at least 4 questions correctly to obtain a passing score. Good luck!